I would like to speak on a few aspects of diabetes. The most important would be which comes to the mind is the diabetes and the genetic risk and the risk for diabetes. As all of you know, diabetes has got both components of a genetic factor and the environmental other risk factors. So diabetes, like in type 2 diabetes, there is a genetic predisposition. Along with that, the other environmental and the weight and the diet, all that adds to the getting diabetes at an earlier age group. So even if you've got a genetic predisposition to develop diabetes, as such as one of your siblings or your parents are a diabetic, so that means you have got some genetic risk of getting diabetes. You could either prevent or delay the onset of diabetes by paying attention to the other acquired risk factors like the weight reduction, if you are physically active, eating a proper diet. So we always think of diabetes as a genetic predisposition plus some risk factors which could help you in preventing or delay the onset of diabetes. I'd like to speak on diabetes in women. Now, as you all know, diabetes affects both male and females equally. Unfortunately, it is the females who develop more severe diabetes, who develop more severe complications due to diabetes. And it has been seen that the females who have diabetes have a more higher incidence of heart problems and more severe heart problems than people without diabetes. And exactly why this variation occurs is not very well characterized, but however, it is the hormonal changes. Second, the females, the ladies have more depression when they go and when they have diabetes. Unfortunately for them, the level of exercise is not as much as what is there in the males. And the time given for them to look after themselves with the exercise, the diet control is very difficult. So it is invariably the females who have a more severe diabetes, who are not properly controlled, and unfortunately they are also prone to develop more problems due to diabetes. I'd like to speak on pregnancy and diabetes. Now, because of the hormonal changes, the diabetes can manifest for the first time in a pregnant lady, and this is called gestational diabetes. Usually, gestational diabetes becomes all right after the pregnancy, but however, they are at risk to develop diabetes again at a later stage. And we can look at it as these are predisposed people who develop diabetes due to the stresses of pregnancy, and even though it becomes that glycemic sugars are normal post pregnancy, we know that they are at risk to develop diabetes at a later stage. So hence, all gestational diabetes should be monitored frequently to see that they don't go into develop frank diabetes at a later stage. Second is they should they should give more time to the exercise, the food control, even post pregnancy. Now, gestational diabetes itself has a problem in pregnancy. There can be complications to the baby. Birth anomalies can develop. The fetus could develop a high birth weight, and deliver problem during delivery can occur. So, and gestational diabetes is a very important component and should not be overlooked at all. Continuing our talk on the women and the diabetes, I think a short talk on the effect of menopause and diabetes is warranted. In menopause, there is one, weight gain, and weight gain will increase the insulin resistance. The sugar control sugar will go out of control. That is the most important. Because of the weight gain, the insulin resistance increases and diabetes control becomes more bad. Secondly, in menopause there are hormonal changes, and again that will affect the sugars. After menopause, these persons are more at risk for developing both cardiovascular and cerebrovascular problems like stroke, heart attack. So the incidence increases much more than what would have occurred in the same age group of males. And postmenopausal females are also more prone to develop a urinary tract infection or other infections, especially the genital tract, and this could lead to the sugars going out of control. So the other problem with menopause would be the postmenopausal depression, and also lack of sleep, which they complain, and hence less of exercise which occurs, and again sugars going up. So the attaining menopause in a lady with the diabetes is a major milestone. We should be properly seen. The sugar should be well controlled. They should be told about the consequences, the problems which they can develop during at menopause time, and they should be well prepared both mentally about what changes could occur to them, so that they can accept it and continue with their proper diabetes control. I'd like to speak on diabetes and diet. Now, the main thing that you should remember in diabetes is you should eat well, eat healthy, eat in limits, and have proper portions of food you should be taking. Now, carbohydrates are there universally. You should try to take carbohydrates which are there in green vegetables, the fruits, especially colored fruits. More the color, the more better the fruit, and whole cereals, because the whole cereals will be containing fiber, and especially brown rice, the whole wheat should be more encouraged, because the fibers are very important in diabetes. The protein, protein is very essential for the body, for the muscle, and protein should be from lean meat, and avoid red meat. Now, fat is also plays a major part. Fat though doesn't contribute to the production of sugar. The fat has got more calories, and hence more the fat, more the weight gain, and more the resistance to the action of insulin, and more the sugar becomes out of control. So you should watch your weight so hence fat should be also curbed. Now, the fat it should be taken from in the diet. The fat should be more from olive oil, the flax seeds, fish oils. These are the examples of fat which are good. The certain items of food which should be avoided are the sugary drinks, coffee or tea with sugar, sweetened with sugar should be avoided. Sweetened beverages should be avoided, and the fat like the red meat should be the red meat should be avoided. In the fat, the low dairy fats are more preferred. omega 6 fatty acids are more useful, fish oils are more useful.